Okay, so this morning I will be administering some medications for my patient Martha May. So this morning it's about 7:30 in the morning. So I'm gonna go ahead and administer her 7:30 medications as well as her 8 o'clock morning meds. So this morning she has an order for fluoxetine, some insulin, ceftriaxone, cecobalamin, and a TB test. So I'm in the Omnicell right now. I'm gonna go ahead and do some hand hygiene. I'm verifying the orders, making sure I have the right patients, making sure I'm pulling out the right medications at the right time, the right dose, the right route, as well as the right documentation. So I'm gonna go ahead and pull out the fluoxetine here. I'm pulling out the insulins right here, fluoxetine, cecobalamin, as well as a TB test. I'm gonna go ahead and do the dosage for my medication. So the first one this morning is fluoxetine. It's an order for 60 milligrams. And the pharmacy is providing me with 20 milligram capsules. So my first medication, she's getting 3 capsules of fluoxetine. So I'm gonna go ahead and pull these out, as well as some water for my patient. Okay. Next, I'm gonna give her some insulin. So I did check her insulin this morning. It's a little elevated, so I'm gonna go ahead and give her 10 units of Humulin and then 2 units of Humalog. So I'm gonna go ahead and do some hand hygiene once again. I'm gonna go ahead and make sure that my Humulin is nice and mixed. Okay, I'm gonna go ahead and clean my vials here. Opening up my insulin injection, and I'm gonna go ahead and draw up 12 units. And I'm gonna inject 10 units into the Humulin. Okay, I'm gonna inject the remaining 2 into my Humalog. I'm gonna draw up my 2 units of Humalog. This one, and then draw up my 10 units of Humulin. Okay. There are my 12 units. Okay. So I'm gonna go ahead and use that for my injection for my patient. Next, we have ceftriaxone, and the order is 0.5 grams. And the pharmacy has provided me with a 1 gram vial, and I do have to reconstitute it. So I'm gonna go ahead and do that dosage. Okay, so she's getting about 1.4 mils of ceftriaxone. Okay. And I do have to reconstitute it, so go ahead and do that. Do some hand hygiene here. Got my powder vial and my reconstitution. Pop these open. I'm gonna go ahead and clean the vials. And I do have to administer about 2 mils of the liquid in there. So my 2 mils. Go ahead and inject that into here. And mix it. Okay, now that it's nice and mixed, I'm gonna go ahead and drop the 1.4 mils of fluoxetine. There's my medication of fluoxetine, my patient. Okay, next we have cyancobalamine. So the order, this medication is 200 micrograms. And the pharmacy has provided me with 1,000 micrograms per 1 ml. Okay, so the answer is 0.2. So she's getting about 0.2 mils of cyancobalamine. Okay, so I'm gonna go ahead and drop that medication. I'm gonna go ahead and clean the vial. There's my medication with 0.2. Okay, lastly she has a TB test, and for this one we're given 0.1 mils for this. I'm gonna go ahead and open up that vial as well. Go ahead and clean it. And then using my TB there's my medication with the 0.1 for my TB test for my patient. I'm gonna go ahead and grab some alcohol pads for my patient. Okay, so I've already put all my medications. I'm doing my second verification check, making sure that my orders do match with what I've done up with my calculations. So I'm just verifying that again. I have the 60 milligrams of fluoxetine, my insulin, which I'm giving her both insulins in the one syringe, the 10 units of Humula and the 2 of Humalog, the 0.5 of sulfaxetone and cyancobalamine, and then the TB test. Okay, so next I'm gonna go ahead and walk into my patient's room. So, hi Mary, Martha, sorry. My name is Andrea and I'll be your nurse today. So this morning I'm giving you your medications as well as some injections this morning. Can I verify your name and date of birth? She tells me her name and date of birth, and it does match my MAR. Okay, Martha, so this morning I have some fluoxetine for you this morning. Do you know what fluoxetine does and why it's being given to you? She said no. Okay, Martha, so fluoxetine is just given for your chronic depression. You are getting 3 capsules this morning. So I'm gonna go ahead and give you these. Do you have any questions before I proceed with the medication? No? Okay. So here's your 3 capsules in your water. Okay, she took them just fine. Next, I'm gonna give her insulin. Okay, Martha, so your insulin this morning was a little elevated. So according to our sliding scale, I'm going to give you 10 units of insulin, 10 of Humulin and 2 of Humalog. Do you have a preference as to where I inject it in your body? No? Okay. All right, Martha, I'm going to give you the insulin injection. So pretending that these fit, I'm going to put them on. Okay, Martha, so once you're discharged from our facility, it's important that you rotate your insulin injection sites. You can inject them in the back of your arm, in your belly, in your thighs even. So just making sure that you keep rotating them so your body doesn't bruise up and it becomes painful. Okay, so I'm gonna inject you with the insulin. And again, I'm verifying that it matches. I'm doing my last verification check at the bedside before administering them. So I'm gonna go ahead and wipe her belly. And again, I would have gloves on for this. Okay, so I'm gonna grab the syringe with the bevel up, kind of pinching a little bit so it doesn't hurt. I'm going at about a 45-degree angle. And injecting the insulin. Okay. And then recapping it, throwing it into my syringe box there. Next, I'm gonna give her fluoxetine. Okay, Martha, do you know what that's being given to you? No, okay, so about a week ago, your daughter found you at home. So you were admitted at the hospital for a UTI. So this is just a UTI medication that helps fight infections, and it is given to you every 12 hours for 5 days for that UTI. So this is gonna go into your muscle. It can go into your deltoid, your ventrogluteal, or your vasa lateralis. So for the purpose of this, I am gonna give it to you in your ventrogluteal. So I'm gonna go ahead and do some hand hygiene. Put on my gloves. I'm gonna go ahead and clean the area. Okay. And then we are doing the Z-Track method here. So I'm gonna go ahead and make sure that the bevel's up. Again, I would have gloves for this. And for this purpose, I'm using my thumb as a Z-Track method. Go ahead and track the skin back, going at a 90-degree angle, and then injecting the medication. Okay, Martha, you're doing great. Any questions so far, Martha? I'm discarding these into my sharps container. She has no questions. Next, I'm going to give you your stencobalamine. So this is a vitamin B12, Martha, and it's just given to you once a month. And it just helps with your nervous system and your nerve functioning. And this one's also going into your muscle. So this one, I will be giving it to you in your deltoid, if that's okay. So I'm going to go ahead and do some, wipe the area as well with gloves on. I'm going to go ahead and do the Z-track method as well, making sure the bevel is up. Okay. Doing the Z-track with my thumb, 90-degree angle, and injecting the medication. Okay. I'll be discarding this in my sharps container. And lastly, I'm doing my TB test. Okay, Martha, because you're new to our facility here for rehab and for treating your UTI, we do have to do a TB test on you. So what the TB test does, it just basically tests you and make sure that you haven't been exposed to tuberculosis. Tuberculosis affects your lungs and you'll be coughing up blood, and you pretty much wouldn't be here right now. So with the TB, I'm injecting into your forearm. It should form a bleb. It shouldn't hurt, and the bleb shouldn't last for too long. I will come back and read it in about 40 to 72 hours. In the meantime, try not to scratch it, be exposed to the sun, or find ways to irritate the area because it could make it false positive. And if you have any discomfort, any questions, please let me know, and I'll come and assess the area. So I'm going to go ahead and do this on your forearm, Martha. I'm going to go ahead and wipe the area. Make sure that the bevel is up. I'm going to go ahead and inject it. Okay. Oh. Okay. And we have bleb there. I'm going to discard it in my sharps container. Okay, Martha, so this morning I've administered you your fluoxetine for your chronic depression, your 12 units of insulin, your sulfaxetone for your UTI, stencobalamine for your vitamin B12, as well as a TB test. If you have any questions, let me know. Are you in any pain right now that I can get you any medication for, Martha? No? Okay. Well, thank you, Martha. I'll go ahead and chart and clean up everything.